Again, good afternoon, everyone. Thank you for joining today's celebratory presentation, where we are going to be graduating the spring 2023 cohort of the Public Health 360 program. This event is taking place, here in Washington, D.C., in the United States, and is also streamed across the world on YouTube, on Facebook. So I am so excited. This is the day that makes me it gives me the greatest joy seeing the fruit of your labor over these 3 months, seeing that come in fruition. So I am hoping that by this graduation, it does not mark the end of learning for you. I hope you will continue to learn. I hope you'll continue to put in practice all what you have learned over these 3 months, regardless of where you are, at the global level, at the national level, at the state level, or even at your local level. Brian, can you allow me to advance the slides? Okay, thanks. So we're going to begin. Here is a rundown of what we are going to do today. We're going to begin by welcome, then we introduce 360 faculty and staff. Then we are going to have the Public Health 360 fellows introduce themselves according to the last name. And then we are going to have presentation number 1. After presentation number 1, we're going to have some questions and answers, and then we go right to group 2. But within where we're doing the introduction, once we finish the introduction of the fellows, we are going to have our guest speaker for today. We will introduce him, and he will send words of encouragement and words of words of felicitation, and then encourage you to go forward in the field of public health and continue to do good. So that's what we are going to do today. And any questions before we run through this agenda? Brown, you can stop sharing so that we can take a screenshot of everybody who is in attendance. And please keep an eye on the Zoom so that when people are coming in, we can allow them in as well. All right, so we're going to begin today with introduction of the Public Health 360 staff and faculty. Everyone, you know me here, Romy Azuine. I am the lead faculty here at the Global Health and Education Projects. I direct the program, and my goal is actually to lead a group of highly talented professionals who are spearheading this program, developing the capacity for next generation of public health program professionals from across the world. So I'm going to hand it over to Brown to introduce himself.
Sure. Thank you, Dr. Romy. So my name is Brown Magnus Olivers. I work as an outreach and IT coordinator here at GHCP. And over the last 3 months, I'm excited, seeing what you guys have begun. So I assisted the team, the fellows and the team, getting the message to you all, communicating to ensure that we're right on track. And I'm happy that this day have come, and I look forward to see the wonderful project you guys have developed. So I work, as I said, as an IT and outreach coordinator here for GHCP, and I'm glad that you guys, are going to be stars out there. Thank you so much, Dr. Remy.
Thank you, Dr. Zubi.
Hi, everyone. It's good to see everyone, and I'm really very happy that you guys started this journey and you are, completing it today. I'm so excited to hear, your presentation. And my name is Dr. Nzube Eboluche. I am the program navigator within the Public Health 360 Fellowship Program. I know most of you may have come in contact with me right from the beginning of your process and until now. I'm really excited and ready to hear your presentation today. Looking forward to it. Thank you.
Thank you, Dr. Zubi. Dr. Susan is unavoidable. I think she's not feeling well. So we're going to go straight out to the fellows. I am going to read, just call people actually according to the way they are appearing on my screen. David Barnett. You are muted. So everybody remember, when you are not talking, mute yourself. When it's your turn to speak, unmute, and then you talk, and then you try to unmute. If you are leaving your station, or if it's somebody, a family or pet is coming near where you are, good etiquette is, you turn off your video and then turn it back on to avoid some distractions. Thank you, David.
Yes, my name is David Barnett. I'm here in Washington, D.C. I am one of the fellows at Global Health Education Project, Public Health 360, and I've been very excited through the program. It has been a great opportunity, and I'm looking forward to use it to the best of my capability. It was very nice working with my team. They were very productive. I got to learn a lot from them. So I will look forward to keep in touch with them. And all of the professors were very interesting, very informative. I enjoyed the program very well. And it's very nice being with everybody. So I'm looking forward for this graduation today and to present my part of the project with my team. Thank you.
Thank you so much, David. It has been a pleasure having you in the program. Next, Dr. Irambona Wilfred.
Thank you, Dr. Romy. My name is Wilfred Irambona. I'm a medical doctor from Burundi. Today, I'm invested in community health in rural zone, and it was an opportunity for me to join this program. And I learned many things, and I look forward to use it for my next steps in my career. And I get also this program opportunity at my current job to get a promotion as an operation officer in Burundi for our program. And this will help me, especially this program, especially the grant proposal, what we study, how we develop a grant proposal. This will help me for sure during my current work, but also I'm looking forward to keep in touch with the whole team, a good team that we work together, but also with our facilitator. So thank you very much.
Thank you so much. Sharon Omondi.
Hello, everyone. I am Sharon Omondi. I am Kenyan, but I'm currently based in Japan. I study a Master's of Public Health out here in Japan. And my general experience through the program has been an amazing journey. And especially for me, because I'm a pharmacist who is trying to transition into public health, it has equipped me with a lot of skills that I feel like I'm going to be using in my future, and especially the development of a program and grant proposal. So it was a nice experience. I enjoyed working with the faculty and with my team members, and I look forward to keeping in touch. And I look forward to also hearing our discussion today. Thank you.
Thank you so much, Sharon. Dr. Derek Jones.
Good afternoon, everyone. I'm Dr. Derek Jones. I am a veterinarian by profession, but I am also getting my master's in public health from Walden University. I'm based here in Washington, D.C. area, specifically in Maryland. It has been an absolute pleasure working with GHEP Public Health 360. I've learned a lot about cultural diversity and public health through the program and through working with my group and my project. I'm very excited about presenting our project today and graduating from this great organization and looking forward to continuing to work with everybody here. Thank you.
Thank you so much. Chivikwa.
Good afternoon. My name is Himer Mbishibikwa. I'm an environmental health practitioner from Namibia, but currently in the UK. I've enjoyed this program a lot. I've learned quite a lot in terms of public health, in terms of the space in which I want to maneuver myself in terms of career-wise, and also been able to pick up career objectives just from the program. And then one thing also, I was able to just write even my personal statements when I was applying for different masters here in the UK, and I've been able to get at least 3 admissions. So I'm grateful, and I look forward into presenting our project. Yeah, I've learned quite a lot.
That is fantastic. Really, really fantastic. Next, I have Mary Bates.
Hello, everybody. My name is Mary Bates. I'm a registered nurse by profession. Currently, I am near completion my master's degree program with Capella University, and I am thankful that I had the opportunity to do my practicum with Global Health Education Projects. I'm also thankful that I have been given the opportunity to work with other colleagues from around the world to build the maternal and neonatal project for the disparities of health in Zimbabwe. I'm looking forward for this presentation and for future use of this skill. Thank you.
Thank you. Dr. Joanne.
Yes, Dr. Rumi. Hello, everyone. My name is Abdulrahman Jarwan. I'm a medical doctor by profession. I hold a baccalaureate degree of general medicine from Hadramaut University in Yemen, working as a national emergency doctor at UN Clinic Yemen. I studied. I has been a very amazing journey, and especially for me because I am a medical doctor who is trying to transition to have me care. It has my lot of skills that I feel.
Dr. John, you're on mute.
Okay. Thank you. Hello, everyone. My name is Abdulrahman Jarwan. I am medical doctor by profession. I hold a baccalaureate of general medicine degree from Hadramaut University in Yemen, working as a national emergency doctor at UN Clinic Yemen in treating emergency medical and case and different age of groups and in health promotion activities. I am very happy to be one of the fellow in this program. And it has been a very amazing journey, and especially for me, because I am a medical doctor who is trying to transition to have me care. It has equipped me with a lot of skills that I feel like I'm going to be using in my future, and especially the development of a grant proposal. So the nice experience, I enjoyed working with the faculty and with my team member. I look forward to keeping in touch, and I look forward to also here in our discussion today. Thank you.
Thank you so much, Joanne. This is really terrific. Emmanuel Idoko.
Good evening, everyone. I'm Emmanuel Idoko. I'm a Nigerian, also a pharmacist by profession. Currently, I'm doing my master's in public health in Ahmadu Bello University Zaria with concentration in health promotion and prevention. The GHEP program has been quite helpful for me because I've been able to honor my skills and sharpen my skills. And I believe that with with the knowledge, skills, and experience gained, I'll be able to impact more in my field of work, and hopefully also gain a PhD program to advance my knowledge. Thank you.
Thank you so much, Emmanuel. Who is next on camera? Dr. Kwada and Sundua. And he goes off camera. Oh, he's here. Dr. Kwada, unmute yourself. Yeah, you can speak now. You're muted. We can't hear.
Sorry, I'm using both my handset and system because 1 minute. Yeah. So, hello. Good. You can't hear me? You can't hear me?
We can hear you.
Hello? Should I use, let me use this thing.
Just go ahead. Go ahead. We can hear you.
Okay. Hello, good afternoon, good evening, good morning. I am Dr. Kwada Subachagwa. I'm a veterinarian working with the Master Minister of
Okay, I think we have major connectivity issue there. Let's see, is
development. I'm also an epidemiologist.
okay. So I think Dr. Sundua is having major connectivity issues. So we're gonna go over to Ology. You have to unmute yourself. You have to click unmute.
Good evening, everyone. My name is Oluchukwu Francisca Eboluche. I'm a psychologist by profession. Currently, I work as a interesting journey in PH360 program. Honestly, I'm very much excited about the program development. It's my first time developing a project and I've learned a lot. And I look forward to leveraging on the knowledge and skills that I've gained from this program in the future, and also working with the team in the nearest future. Thank you.
Thank you so much, Ology. Dr. Kwada, do you want to try once again before we proceed?
Unless I have to put off video if you people want me to hear. If I put video, the thing will take off. Should
So
we
you
do
can,
that, or
yeah, you can do that.
And Dr. Kwada, yes, you can speak with one of the devices and mute the other one. You know, so you can go ahead and
okay.
You can go ahead. Yeah.
Please just give me a minute. Okay.
Go ahead, we can hear you, Dr. Kwada.
So my name is Dr. Kwada Sundoachagua, a veterinarian and epidemiologist. As I just mentioned before, I am working with a fellow, about 5 of them, on the maternal and neonatal mortality rates in Zimbabwe. So this training has shaped me in a ready-made option of determinants that it has
Brown, can you go ahead and mute Dr. Kwada? We will get him later on, but we will continue with the program. Thank you everyone for all your introductions. And it is so exciting that Dr. Joanne is on video, the audio is working, the video is working. That tells you that today he recognizes that today is a very important day. So I thought that Yemen had the worst network, but Nigeria does. Neither Oluchi nor Kwada from Nigeria could join the call today in any way. So that is a little bit sad. So thank you, everyone. Now I am going to go ahead and introduce our commencement speaker. It is important for you to listen. Today, our commencement speaker is Dr. Magnus A. Azuine. Dr. Azuine holds a Doctor of Philosophy, a Master of Public Health, a Master of Science, degrees in Biochemistry, in Public Health, and in HIV/AIDS, as well as in genetics. Dr. Azuine joined the National Institute for Child Health and Development, which is one of the 27 institutes of the U.S. National Institutes for Health. In this role, he serves as a scientific review officer and joined the NIH from the Health Resources and Services Administration, which is part of the U.S. Department of Health and Human Services. Dr. Azuine started his federal career as a public health analyst and project officer in the Department of Health and Human Services, HRSA, in 2009, and started then with the Bureau for Health Profession. In 2012, he moved over to the Bureau of HIV/AIDS at HRSA and stayed there for 10 years, where he continued as a program officer for the Ryan White HIV/AIDS program, the largest federal program designed specifically for people with HIV/AIDS and serves over half of all those diagnosed with HIV infection in the United States. His last duty at HRSA was as a project officer for the Public Health Scholarship Program in the Medical Training and Geriatrics Branch, Division of Medicine and Dentistry, Bureau of Health Workforce. Prior to joining HRSA, Dr. Azuine worked as assistant scientist at the Bloomberg School of Public Health, Johns Hopkins University, Baltimore, Maryland. As a research associate, Department of Medicine, Biochemistry and Molecular Biology, George Washington University in Washington, D.C., and as a visiting scientist with the Department of Pharmaceutical Sciences, Howard University, Washington, D.C. He has published extensively in scientific journals, presented in national and international conferences, and contributed to many books. Dr. Azuine received his PhD in biochemistry from the Cancer Research Institute, the #1 cancer institute in India at the University of Bombay, India. He received a master's degree in life sciences from Sardar Patel University, India, and then obtained a master's degree in public health with specialization in global health and a postgraduate certificate in HIV/AIDS studies from the George Washington University, Washington, D.C. He completed a postdoctoral training in pharmaceutical biology at the Institute for Pharmacy, Freie University, Berlin in Germany. Dr. Zune is also a recipient of the Alexander von Humboldt Research Fellowship Award from the Federal Republic of Germany. Please, fellows and friends and guests, join me on mute and let us give Dr. Zune a round of applause and welcome. So like you can see, Dr. Zune has seen all the length and breadth of public health. So the fact that he's joining us today to see what we have grown means that he understands everything about public health, regardless of where you're talking about, whether you are from Europe, whether you are in Asia, whether you are in United States, or whether you are in Africa. So it is really an honor to have him here today as our commencement speaker so that he can also see the product of this group over the last 3 months. Dr. Zune, the microphone is yours.
Yeah, thank you so much, Dr. Romy, and everybody present. I sincerely appreciate the opportunity that you guys have given me to share a little bit of what public health means to me with you guys. But first of all, I want to, congratulate you guys. Even if you we have this proverb that even if somebody doesn't congratulate you, congratulate yourself. You have done something spectacular. Although I'm not part of your faculty, but I still know very much about what you guys are doing. And you guys are filling a hole that is very much lacking in public health today. So I want you guys to look at yourself that you have accomplished something, and thank you for coming to join the public health world. We need a lot of people in this field. We need a lot of individuals who are not just theoretical, but having that basic concept of what public health is all about. That is most important. So I want to start by saying thanks to the faculty, thanks to Romy and the team for organizing this. This is difficult. I'm telling you, when you look at it, even how to organize people from more than 7 countries to be on the same platform is a task that is well appreciated. So thank you all for putting in the efforts. Back home now in Nigeria is about 4 or 5 o'clock. People could have been using their data to do something else, to watch YouTubes and other things, but you are spending this time quality day on Saturday from Japan, from Burundi.
No, 5 to 7.
Okay, so that's to tell you that. So for you guys to actually devote your time to this is a work of compassion, which I sincerely see a big vision for all of you. So thank you for being part of this team to actually help move public health forward. So the only thing I want to tell you is that this is a field that is pushed by compassion. People who have been successful in public health, starting from whether you talk about the cholera, whether you talk about Louis Pasteur, about the vaccination, all of these people have one thing in common. It's not just the degrees they have, but the compassion, the dedication that they have for a cause. They look for one thing. Based on my own experience, I've been a scientist for a bench scientist, laboratory scientist for about 22 years. For those from Nigeria, I started working in Nigeria with the National Institute for Medical Research in Lagos. and then moved to National Institute for Pharmaceutical Research and Development in Abuja, where I spent almost 6 years looking at drug development in Nigerian medicinal products. When I came to the United States, my basic benchwork was in looking at alcoholism, looking at working with the veterans and looking at markers. Because when you say somebody is an alcoholic, all you ask is basic questions, but do we have biochemical markers to indicate someone or the stage of alcohol dependency? That was the project I did for 7 years. And during one of our clinical trials, that was an international clinical trial in the US with samples from US, 2 hospitals in US, from Australia, from Sweden. That was the first time I came in touch with individuals, talking to people, not just talking to laboratory animals, because we needed human samples. I had a project that if somebody reports to one of the 3 hospitals, for those in Washington, DC, Providence, George Washington University Hospital, and Howard University Hospital, with any symptom of alcoholism, even if it is 12 a.m., I'll be called to come to the hospital to collect samples from these individuals, trying to determine their glycoprotein. And before that, we have to sign consent. And I got to understand that sometimes people are alcoholics, not because they want to be alcoholics. Nobody wants to be an alcoholic. People are alcoholics because of circumstances that surround them, because of issues. In the Veterans Affairs where I worked, we had a lot of people that came down with PTSD, post-traumatic stress disorder, that these are young kids that 18 years, 19 years, they are shipped off to war. When they come back, they don't know where to start. Their whole life is a little bit messed up. So the only way they can calm down the noises of war or the trauma of war is resorting to substance use. And those substance use are things that lead to what you talk about, mental health, a lot of them with mental health, a lot of them with homelessness, a lot of them with drug use. So my take then was not that these guys it's not just medication, it's not housing them that is the problem. The issue is that you have to go beneath the wave to know what is their problem. And that's where Romy here, your program director, introduced me to public health, because I was asking questions. I was asking, why is it that somebody who has been very successful, you see him in Washington, D.C., is homeless? But this is somebody that has sometimes about $100,000, $200,000 in their accounts, but they still remain homeless. So I was still posing that question. And when I started my journey about, let's say 17, 20 years in public health, some of the answers started making sense. It's like somebody who is a drug addict, removing drugs from him does not treat him. You have to go to the underlayers to know what is the cause of that problem. And that's where public health comes in. I want you to look at yourself as someone who is equipped. What you are learning is not the theoretical part. What 360, PH 360 does is to give you the basic understanding of thinking like a scientist, thinking of public health as something not distant. Like Romy mentioned, I had taught students in universities for quite some time. But what I try to let them know is that, no, the books are different, but develop yourself, immerse yourself as a scientist. And a scientist is in anywhere, any place you see yourself, think of solutions, interventions. That's what public health teaches you. You guys now are going to the field. Ask yourself, what is public health to me? There are so many definitions of public health, but what does it mean to you in your own environment? In the United States, we can talk of gun violence as public health issue. We can talk of suicide in Korea as public health issue. In Nigeria, what does public health mean to you? What are the issues that you have in the country that you can solve with the knowledge that you've gained today? This is what I want you guys to think about. If you think of issues, if you think of public health is being a doctor for all. A clinician treats one patient, but public health scientists treat the whole population. Everybody like you now, you drive a car, you enter your car, you start the car, the first thing you put is seatbelt. Seatbelt is public health intervention that has been shown to save lives. Save lives in millions all around the world. That is product of public health, and it does not take rocket science for someone to develop that knowledge. I want you to go back, look at your surroundings as public health, and look at your surroundings as your laboratory that will give you the tools for you to achieve something. There is one program I want you to take a look. When it comes up, it's called CNN Heroes. When you look at Anderson Cooper, CNN Heroes, all the people that are in this program are individuals who have used public health interventions in solving local problems. You can be a hero. You have been equipped to be a hero. Go back to your place, look at what are the problems in your place. Look at what issues you can solve, and look at how you can use what you have learned in public health 360 to be able to develop interventions for that. That is what I charge you to do. The second aspect I want you to do is that look at the teams you've met. These are your friends. Make sure that you keep in touch with each of them. You don't know where you're going to meet. They will be able to understand where you're coming from. They'll be able to understand collaborations that you want to build, and will be able to work with you in terms of developing interventions. And another thing I want to ask you is that when you are someone in public health, I want you to understand that the world is very small. For people who live in Washington, they know 2-3 days ago we were suffering from smoke from Canada. Canada had a wildfire, which is a normal annual issue they have. But this year, the smoke from Canada blanketed all through the northern part of Washington, D.C., all through the United States, so many states in the Northeast, down to Washington, D.C. That is a public health problem. How do you solve that problem if you're in Canada? How can you prevent it from happening? So I want you to think about it as the world as your experiment. Wherever you live, wherever you stay, that should be your experiment. That should be your laboratory. Look around, look at the problems that you can help people, look at the problem that you can solve. It does not need to be a very, very fantastic. It could be a little thing that makes a sense in saving 1 or 2, 3 lives. That is public health. And I want to say that I thank you for giving me this space, but I charge you to go into your place, think about it, think about what you can do. And you would have done justice to Public Health 360, and you would have done justice to Global Health Education Program for them to continue to do this, to train the workforce. We need these people. We need you guys to be in the field. And I want to say thank you, and I'll be open to answer any of your questions.
Thank you so much, Dr. Azwina. Thank you so much. Please join me and thank her. Yes, thank you so much. We are going to take 1 or 2 comments or questions for Dr. Azwina, and we move on to the next program. Really challenging you to go and make changes in your communities, in your country, and for the global community. All right. Look at the flag. Is it not so beautiful to have all of you from different parts of the world, different parts of the continent represented here? And the state of Maryland as they underlie there. You can see where you have all come from, far and near. to become today graduates of the Public Health 360 Fellowship in Washington, D.C. This is so exciting. You know, and it really brings some chills down, knowing that in all corners of the world, you will be there making changes. All right, Brown, we can take down the slides and then go straight to presentation number 1. This is the time that I am so excited. We're gonna see these programs, you know, for the first time. We don't know who is on the line, whether they are funders, whether they have their money, whether they have their checks right here waiting and willing to write a check. So we need to convince them that these programs are worth funding. So group number 1, the groups will come, they will introduce themselves, they will introduce their program, and they will run it. So group 1 developed a program called Mental Health Awareness Training, MHAT, for Youth Project. Mental Health Awareness Training, MHAT, for Youth Project. So I'm going to hand that over to the group. Dr. Derek Jones, I think you are leading this group. Over to you now. Brown, give him authority to share slides. So as he's coming on, please take notes, note your questions. At the end, we're gonna have 5 to 6 minutes of serious questioning to really know whether this is a project that we should be funding or not. Dr. Jones, are you there?
Yes, I am pulling up the slides now. It's waiting for it to go into presentation mode. Okay. Thank you, and good afternoon, good morning, good evening to everyone. We are Group 1. We have the Mental Health Awareness Treatment Program. The T is for treatment, not for training. Just wanted to make that correction. But we are Group 1, made up of Emmanuel Doko, Umazimbi Chivukwa, David Barnett, myself, Derek Jones, and Olichukwa El Boloche. And we are presenting today, again, our project, Mental Health Awareness Treatment for Youth. So a little bit of background about us. Again, I'm Dr. Derek Jones. I have my Doctor of Veterinary Medicine degree, as well as a BS in biology. And for this particular project, I'm the project manager and executive director. We have Oluchi Ebojule, who has her BS in psychology, and she will serve as our monitoring, evaluation, accountability, and learning or meal coordinator. We have our Edoko Emmanuel Ojubane, who has his Bachelor's of Science in Pharmacy and his MPH is in progress, who will be our grant specialist. David Barnett, who has his Master's in Public Health and Administration, who will be our Mental Health Activity Coordinator. And Emezbi Chivukawa, who has his Bachelor's in Environmental Science and Health Science, and he will be our Communication and Outreach Officer. For today, this is what our outline will be in regards to our presentation. We will have our executive summary, our introduction, problem statement, population needs, goals and objectives, project management, work plan, partnerships, budget, program evaluation, and dissemination. And I'll turn it over to Emmanuel.
All right, next slide, please. All right, so the Mental Health Awareness Treatment for Youth is a web design project that aims to improve mental health well-being of Nigerian youth by increasing awareness, reducing suicide rates, and increasing mental health service uptake in Nigeria. Now, this MHAT is very important because according to WHO, health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease. It therefore means that for us to say someone is healthy, we are looking at both the physical health, the social health, and the mental health. Therefore, our program on mental health has come to actually check the mental health of the Nigerian youth to see whether they are really healthy or not. The project needs mental health is important in order to achieve an overall health of human being, according to WHO, and also the Sustainable Development Goals. According to data, rate of mental health is high in low and middle income countries, example, Nigeria, and 14.3% of deaths worldwide are due to mental health conditions. Thank you. Next slide, please. Okay, so our MATs for Youth projects would target SDG number 3.42 and 3.53, which is reducing the suicide rates and coverage of treatment intervention for substance use disorder, respectively. So we hope that at the end of our project, we would have been able to reduce suicide mortality rates from 3.5 to 2.5 in Nigerian youth, and also increase mental health service uptake and coverage from 10% to 20%, thereby ensuring that all Nigerian youth are being diagnosed if need be for mental health issues. Thank you.
Thank you, Emmanuel. Next, we'll go to Oluchi.
Next slide. All right. The WHO has described the need for action for mental health as undisputable and urgent. This is as a result of the statistics about mental health, with over 14% of deaths being attributed to mental health conditions worldwide. Also, the cost of treating depression and anxiety will surpass that of non-communicable disease by 2030 if projects like MHAT for youth are not put in place. More than 75% of people in low and middle income countries do not receive treatment for depression, thereby making the impact of this condition worse. Africa has the highest number of children and adolescents globally, yet has the lowest government expenditure on mental health. Statistics have it that children and adolescents are more impacted by mental health and they are more predisposed to mental health conditions. And Africa, having the largest number of children and adolescents, yet has lowest government expenditure on mental health, which also translates in the low access to care for mental health conditions. Also, over 80% of adolescents in Africa are described as heavy episodic drinkers. This is an indicator that there is high rate of mental health condition in Africa, and also people who have mental health conditions do not have access to proper care, either as a result of stigma, because we have 9 out of 10 people who have mental health condition suffering from stigmatization or discrimination. These statistics are very, very disheartening, and there is need for intervention in mental health program. Next slide. In Nigeria, we have over 60% million people suffering from one mental health condition or the other. Yet only 10% of these 60 million have access to proper care, leaving over 90% in the treatment gap. Nigeria is also described as an epicenter of suicide, coming first in Africa and sixth globally. This is also an indicator that there is high rate of mental health condition in Nigeria, and people that suffer from mental health condition do not have access to proper care as a result of poor government funding, low mental health personnel, poor number of mental health clinic or hospitals for the citizens, as well as other reasons as well, including stigmatization and discrimination. Also, the global rate 3.59 rate, which is 3.5, and yet needed attention, the needed attention that it deserves both in Nigeria and globally. The last but not the least, over 14.3 million persons aged 15 to 64 years abuse illicit drugs in Nigeria. In other words, this is about 15% of Nigerian population abusing illicit drugs. This is also an indication that the rate of mental health condition and its impact in Nigeria is very, very disturbing. Next slide. The mHeart for Youth project, which stands for Mental Health Awareness and Treatment, is imperative in Nigeria to contribute in reducing the suicide mortality rate, as well as increasing the mental
Did we lose her, Brown? Dr.
health
Jones.
service uptake in our SDG target number.
I think any of you can jump in and continue.
Yes, so the project aims at reducing the mortality rate from 3.5 to 2.5 by improving mental health of Nigerian youth and increasing the mental health uptake from 10% to 20%. So these are our population needs. So our project will focus on Nigerian male and females that are aged 15 to 29. By the data that we have found, the target will be 3 states in the 36 states that are in Nigeria. These states will include Bayelsa State, Delta State, and Rivers State. And we will obtain our population that we're going to use in the program from 2 universities from each 3 states and 1 secondary school from each 3 states that have been identified. Now I turn it over to David.
Thank you very much, Oluchi. Thank you. The goals and objectives are to be attained within a 1-year time period. The goals and objectives can be raising awareness about mental health issues among youth in Nigeria and reducing the stigma associated with seeking help. Increasing access to mental health services and supporting for young people in Nigeria, particularly those from marginalized communities and low-income families. Empowering young people in Nigeria to take an active role in managing their mental health and well-being by providing education on coping skills, stress management, and self-care. Developing partnership with schools, universities, community organizations, and other stakeholders to create a supportive environment for young people with mental health issues. Conducting research and monitoring the impact of the program on the mental health outcome of young people in Nigeria, and using these informations to improve and expand the program over time. That is our goals and objective for this project.
Thank you, David. Now we go to Chivukwa.
Good afternoon again. Next slide, please. Himere Mishivikwa, as introduced by our group leader, and I'm going to take you through the project management. We're looking at the staff members, which is we have a grant specialist, which is Ideku Emmanuel, who's going to be responsible for the accurate, quality, and timeless of all financial transactions that are needed in the group, and also be responsible for drafting the final proposal. We have a project manager and executive director, which is Dr. Derek Jones, who will be responsible for ensuring that the project is implemented in the specified time frame. And then he will also be the driving force behind the project implementation. And then we have the monitoring, evaluation, accountability, and learning coordinator, which is the MIL, which is Oloju, that's going to be responsible for ensuring the necessary monitoring, quality, and evaluation, and the impact and effectiveness of the project in all the areas, and then also develop appropriate data capturing process to ensure that the data is captured to ensure that the project is effective. And then we have the communication and outreach officer, which is myself, Himere Bishivikwa. I will be responsible for developing and disseminating all communication strategies and building a strong social media presence, identifying and creating social media accounts for the group, as it's a web-based project. Next slide, please. And then we also have a digital ambassador and a social media influencer, which is still to be announced. And the reason why we added this to our program is that we have identified that there's a gap in public health into putting on social media, because the youth are on social media, and that's our target audience. They'll be able to raise vital awareness, mental health services providers, stemming out the stigma around mental health, because people are able to relate to people that they follow on social media. And then we have a vocal point and gatekeepers. These are people that are in the communities. These are our traditional leaders. They will act as a communication medium between us and the local communities, and they'll be also assisting us in planning the events. And then we also have a mental health activity coordinator, which is David Bennett, who will be responsible for organizing planning events for different universities and assisting in translating certain mental health content that is possible into local languages. Next slide, please. And then here is our structure of the project. Every project has to have structure so that everybody can be accountable. Be sure that you have done your part. Here we have the manager and executive director, and then who flows to the grant specialist. And then here we have the different who are under the grant specialist. We have the communication officer, the male coordinator, and then the mental activity coordinator. And then there are sub-units. Yeah, next slide, please.
Thank you, Chivukwa. We'll go back to David.
Yeah, yes, thank you. The work plan for our project for the year start from August 2023, advocacy visit to stakeholders in Rivers, Delta, and Bayelsa states to sensitize them on importance of mental health and the need for investment in mental health services. From September to October 2023, design and launch a mental health campaign in the 3 states, targeting universities and the public. This will include partnering with relevant stakeholders to organize mental health awareness events and offering mental health screenings. From November to December 2023, capacity building, training 150 health care workers on mental health services and equip them with the skills to properly diagnose and treat mental health conditions. From January to March 2024, offer an online course on mental health services to reach healthcare professionals in the 3 states. 2 psychologists with 5 years of experience will facilitate the course. From April to June 2024, training gatekeepers, 20 church leaders, and 30 mentors who can identify and refer individuals with mental health disorders to healthcare facilities for further assistance. From July to August 2024, establish referral pathways and leakages between healthcare facilities and mental health services, providers to ensure seamless access to mental health services. July to August 2024, from September 2024, conduct community outreach and sensitization program to reduce stigma and encourage the uptake of mental health services. An ongoing collect and analyze data to track the progress and identify gaps in mental health services delivery in the 3 states. This will help to inform future interventions and ensure that resources are being directed where they are most needed. Thank you.
Thank you, David.
Next
Back to Chibukwa.
Next slide, please. I'll take you through the partners that we have chosen. So these partners are people that are going to make our project bigger, that are going to add value to and add the capacity to our program. We are looking at the Mental Awareness Nigeria Initiative, which is one of the largest counseling providers. So they'll be able to give us access to mental health counselors to incorporate in our project. And then another will be the National Drug Enforcement Agency. As we all know, that the use of drugs and alcohol or substance abuse are always linked to certain mental health conditions. And some people also, when you look at alcohol abuse, it can also be used as an alternative coping mechanism for some individuals. So that is where we partner with this organization. And then we are looking at our faith-based organization, church leaders. It's very important for us to engage with them because they are the gatekeepers to the community. And then also it will be able for us to have a conversation on how can we talk about mental health in church spaces. What are the biblical ways of dealing with mental health? What are scriptures that are talking about mental health? What are traditional ways of dealing with mental health besides also just the clinical side? They'll be able to gain the trust of communities and encourage participation in the project. And then another organization we're going to look at that's going to help with our program is the Association of Psychiatrists of Nigeria, which is committed to holistic care of persons with mental health illnesses and promotion of mental health. The partnership with this APN will allow us to use quality and effective treatment method for those that are in need, and we can make referrals as well. Next slide.
Thank you. Now we have Emmanuel for our budget.
Okay. So for us to achieve our goals and objectives for the MART projects, we are looking at a total sum of $150,000. And from the slide, we can see the breakdown. We are going to be having meetings with the stakeholders in Bayelsa, Rivers, and Delta. Also, we're going to be having campaigns and advertisement costing $900. Also, since it's a web design program, we are going to have budget allocation for our web development, which will cost us 2,000, and our web maintenance, which will cost us 1,000. And also we have budget for staff salary, volunteers, consultants, and those that will be working with us to see that the MR project is a go. That will also cost about $126,000. So like I've said, everything will cost $150,000 with the 10% cost, which is $15,000. Next slide, please.
Thank you, Emmanuel. So this is how we're going to evaluate our program. As already stated, this will be a program that runs from October 2023 to September 2024. Our quantitative data will be the percentages that you see here of the program participants that have improved their mental health, reduced substance abuse and use, connected with a certified mental health counselor, and who did not commit suicide from being involved with our program. We're also going to collect qualitative data through interviews, and these interviews will consist of focus groups with the participants, our counselors, and our trainees. So our outcomes that we are looking for our program would be to have met our goal of increasing mental health service uptake from 10 to 20%, a reduction in mental health stigma amongst Nigerian youth, and a reduction in the suicide rate from 3.5% to 2.5% or lower. In addition, we will have an overarching goal of having this program, if successful, which we believe that it will be, to have it be on a go across the country of Nigeria to help in facilitating better mental health across youth, and then be able to take this on a global scale. Emmanuel?
Okay, so the methods we plan to disseminate our findings are as follows. Flyers. These flyers will help us to offer tangible information about the project to the community. Also webinars, which will be through Zoom conference meetings for existing mental health professionals conducted by the project leaders. Also through videos, where we'll create a commercial broadcast on local televisions in the 3 states. Next slide, please. Also, we'll also be discussing our findings on our website, where we post information about the project on mental health website to encourage participation. Also, we're also going to discuss our findings through progress reports, where we hope to summarize our findings to our funders to keep them abreast with the project success, and also bid for more fundings for other states. Thank you.
Thank you, Emmanuel. These are our references. We thank you all for your time and listening to our proposal for our MHET for Youth project. And now we will take any questions. Again, thank you.
Ladies and gentlemen, please join me and give them a round of applause. This is really, really good. Really good, really good. All right, we're gonna, keep those applause coming. Really, really good. So we're gonna take 1 or 2 questions. I have one comment about reduction of stigma around mental health by 10%. I think when you say you're reducing something from, there has to be a baseline that you are reducing from. So do we know what the stigma percentage is in Nigeria? All right, so if we don't know, the trick to do that is to say, is to first of all, to look for data to support that there is a baseline information, what it is currently, and then you base your reduction proportion based on that. If there is no data, right? If there is no data, you can look for data from another country, neighboring country in Africa, or you can actually use stigma proportionate data from any other place and say, for example, in United States, it is estimated that the proportion of people who stigmatize because of mental health is 15%. Therefore, we are going to reduce the stigma by 5%. And always not be too aggressive. I think we talked about that. Make your expectations realistic, but really, really good project. I liked the timeline. I like the work plan. This project with very minimal touch-up is ready to go. Any other comment? Yes, Dr. Azine.
I want to applaud you guys. This is a project ready to go. This is something that is fundable. I'm looking at it from what you guys have. You have touched all the things I wanted you to touch. One other aspect I want you to look at is, in Nigeria, we have different ethnic groups, and mental health is viewed differently in different ethnic groups. So if you're ready to go for funding for this, try it, because the states you selected are in 3 different ethnic configurations of the country. So take a look at what mental health means in those particular areas, because those are what people want to understand, that you understand it. In some areas, people like in the Southeast, they tend to gather people who have mental health together in a room. It's not even what you can think about having that mercy on them. So it's unappealable. So GHEP, what I want to ask you and request is, I looked at the website of the Mentally Aware of Nigerians. I looked at that website. It's very well written. The only problem I have in the website is that I couldn't figure out who is behind the group. So is this something you guys are looking for? One easy way to get funds for this is look at soft grants from organizations to do a pilot study in institutions. Even starting from creating the awareness is one thing. Somebody talking about it by creating a website and using digital world to create that awareness that we look at this. The other issue that I see a lot of suicide in Nigeria is when people are diagnosed of HIV in Nigeria, a lot of people go and commit suicide because of lack of education. So that is, you can target and zero your problems, because if you're talking of suicide is big, mental health is large, you understand? So but this project is something that is that can be taken off the shelf, and actually submitted to some private organizations for funding. So I applaud you for such a very, very beautiful work. Thanks.
Thank you so much. Oluchi, I saw your hand up.
Yes, I was actually, I wanted to respond to your comment to increase
Yeah. Okay, so we'll get back to you. You can use the chat
we have
function.
about 9 assessments. Okay. I will do that.
Use the chat. Yeah. All right. So we are going to move to any other questions. I'm looking. I can't see any hands up. Yeah, David, okay.
Yeah, I just want to highlight on the stigma. Very little research have been made on the stigma in Nigeria. But there is, however, a recent study found that more than 54% hold a negative attitude towards people with mental health. This suggests that mental health stigma is significant issues in Nigeria.
That study, you need to email that. You are part of the group. Use that study to actually, underscore your reduction, and that means a lot, which means it is consistent that you can reduce stigma by 10%. You just need to update that slide and add the citation.
Okay,
very good. Yeah, really good. That's really good. All right, we are moving straight to group number 2. And group number 2 is going to be presenting to us their brand new program, Hello Mom and Baby. Healthcare is a phone call away. And I would like to hand over to Mary Bates, group leader for this exciting presentation. Hello Mom and Baby. Healthcare is a phone call away.
Hello, everybody. My name is Mary, and we are here to present with my other group members, Group 2, Ms. Sharon Awino, myself, Dr. Kwada Chagwa, Wilfred Irambona, and Dr. Abdurrahman Jarwan with Global Education Health Projects. This presentation is called Hello Mom and Baby. Healthcare is phone call away. So for our project management, we have Dr. Kwada Chagwa as our program outreach director, and then myself as the director, and then partnership and outreach director, and our clinical director would be Dr. Abdurrahman, and then data monitoring and evaluation directors would be Sharon Amondi and Wilfred Irambona. Summary. Although Zimbabwe had an overall decline in maternal mortality rate and neonatal mortality rate, both remain significantly one of the highest mortalities among developing countries. Zimbabwe is a part of a sub-Saharan countries, which accounts for 70% of the mortality or maternal mortality rate in 2020, also with estimated 40 million children under 5 will die before 2030, according to UNICEF. The purpose of this presentation is to propose strategy reducing maternal and neonatal mortality by the use of mobile health technology and improve quality access to healthcare involving community healthcare workers in Zimbabwe's rural communities. For our problem statement, in 2022, Zimbabwe's maternal mortality rate is 363 per 100,000 live births, with neonatal mortality rate of 9.5 per 1,000 live births. Most of the maternal and child health care issues occur in low to middle income rural areas where healthcare access is scarce, which results on higher mortality rates compared to urban areas. Among the provinces with highest mortality rates is Mashonaland East. For our target population, our demographics are the following: pregnant mothers and their neonates, high-risk rural community of Mashonaland, for up to 400 eligible participants to match the average rural maternal mortality rate of 402. And last is residents more than 10 kilometers to nearby healthcare facilities. We chose Zimbabwe rural province as they have the higher maternal and neonatal mortality rate compared to the urban areas. According to the Zimbabwe National Statistics Agency, rural provinces have double mortality rate than the urban areas. Mashonaland East has the highest maternal mortality rate and second highest neonatal mortality rate. These numbers in total account for about 60% greater than that of the urban province counterparts. In addition, we also examined the geographical factor, which can be seen on the map on the next slide. Geographical factor distance of nearby healthcare facilities. For example, Zimbabwe rural residents often have to walk 10 to 50 kilometers to connect with the nearest hospital or healthcare clinics due to limited resource and costly transport. This slide shows Zimbabwe's map on the right and a geographical map on the left showing the hospitals, which are in red H, and clinics in blue H. If you can see that there is only one hospital near Mashonaland East and one nearest hospital, which is next right to the city close to Manicaland. We also noted that Mashonaland, particularly the east, is shaded light green, representing intensive farming, which can be assumed to be far out in the rural areas. Wilfred will be presenting the goals.
Wilfred, you are muted. You have to come online. You have to unmute.
Thank you, Azumi. The goal is to reduce maternal and neonatal mortality in Zimbabwe by increasing healthcare access through the use of mobile technology by involving community health workers. The objective is to increase rural women access to health centers, to promote health education by increasing awareness among pregnant women, to increase collaboration between healthcare providers and community health workers. Next, please.
Wilfred, the slide is ready.
Hello Mom and Baby Healthcare is from Coleway. This program aims to reduce the maternal and neonatal death in Zimbabwe rural zone of Mashonaland, targeting up to 400 mothers through mobile health technology project using community health workers network. We focus on the level of Zimbabwe healthcare in the community because these village health workers and the rural health center are the main point of contact with the former health system, and the community health workers are the link between them and the health facilities. So indeed, these community health workers are able to reach the last mile, to how to reach rural zone with other former health provider who can attend all those regions. So we choose to focus on this health system because of these issues. So our project, we provide and train community health workers on smartphone and involve them in innovative and digitalization mechanisms. Next.
Slide is ready. Looks like we lost Irambona. Can someone else take this on?
So the smartphone will be used for communication between healthcare provider and the community health workers, for reminders, calendars for checkup, for prenatal consultation and postnatal follow-up, to provide health information during household visits, as the community health workers are used to visit households for training for treatment of diseases like malaria, pneumonia.
Mary, can someone in the team take this up? You are muted.
Use of technology. We will be using ClickMedics and install it in mobile applications to train the community health workers and also provide data and obtain data from the target population of pregnant women and neonates. For our timeline, we would be introducing a meeting with stakeholders. Then after, we will be recruiting eligible community healthcare workers. Then the next one would be training community healthcare workers on maternal and neonatal health topics with the use of smartphone and health application. We will also conduct bi-monthly refresh on maternal and neonatal health topics. After then, we will be monitoring performances of the community health workers' quarterly performances. Sharon will be presenting the outcome measure.
So these are going to be our outcome measures, and this is how we're going to know that our project has worked. So the first one is reduced maternal mortality ratio by 15% from baseline. And for reference, our baseline in Mashonaland East is 402 deaths per 100,000 live births. And the second one is reduced neonatal mortality ratio by 15% from baseline. Our neonatal mortality ratio as of now is 11.1 per 1,000 live births. The third thing that we aim to change is to increase scale birth attendance by 20% from baseline, and also increase maternal and neonatal health knowledge by 90%. And this means that at least 90% of women trained should demonstrate appropriate knowledge and skills upon assessment. The next one is at least 80% of women should attend at least 4 antenatal clinic. And this is how we're going to increase antenatal coverage in the area of Mashonaland East. The final outcome is to have at least 80% of women should initiate antenatal visits in the first trimester, because we do know that it is very important for pregnant women to go for their checkups early enough so that in case of any issues, they can be noted on time and interventions can be done. Next slide, please. So this is how we are going to evaluate our outcomes. So this is kind of a performance audit of how well our program is doing. The first one is reduction in maternal mortality rates and neonatal mortality rates. How we're going to do this is, first of all, establish the baseline mortality at which will serve as a reference point. And then at the end of the program, the rates will be measured again and compared to baseline figure. Another thing that we're going to do is statistical analysis, which specifically is going to be regression analysis, which will be done to determine whether the changes that have happened are attributable to the program. The second outcome that you're going to evaluate is increased access and utilization of antenatal care. To do this, we're going to look at the number of women registered for our program and the number of, out of those, how many attended at least 4 antenatal care visits, and also how many participated in delivery using skilled birth attendance. And to get this data, we're going to visit local healthcare facilities and go through their records to get the numbers. Then the third outcome that we'll evaluate is increased healthcare worker skills. As part of our in the preparation to carry out this program, we're going to train the healthcare workers on how to use the ClickMedix app. So to be able to evaluate whether they were able to grasp the knowledge, we're going to do a pre-training assessment survey. And then after we do the training, we do a post-training assessment survey. The fourth outcome is increased maternal and neonatal health knowledge among pregnant women. And we're also going to measure this using a knowledge assessment tool that's going to be delivered pre-training and also post-training. Next, please. Here we do have our estimated annual budget. So the first cost item is personnel, and under this we're going to have the staff, that is the directors and data analysts and IT specialists, and it's going to cost us approximately 120,000 USD. Then because we're using community health workers and we would like to give them a stipend, we're going to use 48,000 USD for that. For the equipment, we're going to purchase 40 mobile phones. And the reason why this is 40 is because our target population is 400 women, and we want to use to have at least one community health worker targeting 10 women. So that means we're going to have a total of 40 community health workers, and each of them is going to get a phone. So for the 40 mobile phones, it's going to cost us $4,000. Laptops that we're going to use for data analysis, we're going to purchase 4 of them, and it will cost us 6,000 USD. Data analysis, that is software, that is data, as a license for that, we're going to require 2,000 USD. For ClickMedix software, which is our main software that we're installing in our phones, it's going to be 12,000 USD. Because Mashonaland East is a rural area, we would like to set up a solar charging station at our offices so that the community healthcare workers can charge their phones at that place, and it's going to cost 10,000 USD. To train the healthcare workers, we're going to use 36,000 USD. For community and outreach, and specifically to design and print dissemination materials, we're going to use 20,000 USD. Then because our healthcare workers are using phones, and specifically they're going to be making calls to the healthcare facilities, for example, in instances of referral, they're going to be needing airtime. So we will use approximately 10,000 USD for that. And then for our rent space and utilities, 48,000 USD. For travel and transportation to do outreach activities, but also
Did we lose Sharon? So the network must be really bad today all over the world. That's interesting. Mary, do you want to pick up?
Yes. So partnerships and collaboration, stakeholders, engagement workshops, we had allocated 30,000, and with a total cost of $37,000, and indirect cost of 37, with a total cost of 4,700. That does not seem right. $407,000. Partnerships would be presented by Dr. Jarvan.
Okay, thank you. I'm going to present the partnership. This is part of project is mostly implemented by 4 basic partnerships. The first is the local health authorities, and here they are represented in some departments of health office in the region, such as basic primary health care sector, including the reproductive health department, which will be contribute locally to a large extent in providing and developing health care for mothers and newborns. The second main partner is the pillar of society or community, or non-governmental community organizations. And this is maybe represented in the Association of Women's Civil Union and Women's Development Associations and the Youth Club, as well as social figures in the community, including clerics and tribal sheikhs. As all these community partnership will provide social support for some obstacles in the region, which would affect access to the health center and also provide a kind of health and social education in order to advance women's health and to one of the problem of the maternal and newborn mortality. This is the third major partner here, as we see here, will be technology companies, as Association of Electronic Engineers and companies designed electronic programs and applications, which in turn will provide support in providing smartphone and designing health electronic applications, which will be used in data collection and medical consultations and facilitate and increase access to healthcare services centers and acquire some of the health education throughout these programs and electronic applications on the mobile phone. And this is a project. Also, these electronic companies will train health workers to use these applications and how to benefit from them in order to improve the health of women and infants. University educational institutions are also included in this context. The academy is like the University of Zimbabwe, especially the Department of Community Medicine in the College of Medicine, where support will be provided in the field of studies, research, and health awareness provided by medical students of the College of Medicine to secondary schools and women's club. Therefore, the Department of Community Medicine and Public Health in the College of Medicine has a major role promoting the health mothers and infants. The fourth and final main partner can be mainly the supporting international organizations. And here lies their role in providing financial grants in various fields, the end of which is to promote the health of women, of mothers and children, and reduce the maternal mortality rate. Maternal mortality rate. Among this area is also financial support in the establishment of scientific and medical resources for health workers such as doctors, nurses, midwives, and community volunteers, providing basic and advanced medicine and medical devices, building health units and centers in the remote area most in need, exchanging experience with government organization and local organization in order to enhance maternal health and reduce maternal and neonatal mortality in line with achieving the health goals of sustainable development. These organizations it could be UNICEF, UNFPA, Save the Children, and could be WHO and others. Next slide, please. Dissemination. This section can be implemented by creating a comprehensive report featuring project results, figures, and statistical data, and using papers and summarize the 4 policy marks and vital state and local organizations. By the end of this project, a series of seminars will be held to disseminate the results of the project and make appropriate conclusions available and share lessons learned. These seminars will be at various levels, the ministry level and the government level. The result also will also be shared, can be shared throughout participation in the scientific conference in addition to scientific paper for population for publication. The Ministry of Public Health will use the results of this project and plan evidence-based strategy. Also, by using graphs and we can using graphics and videos for public and publishing academic journal and sharing media of all kinds, such as press releases, interviews, or opinion articles to present the most positive project. Next slide, please. Next slide, please.
This is our reference that
Yes.
concludes our presentation. And now we are open for questions.
Yes, Brown, can you get us off a slide? This is really, really good. This is, please join me and let us give them a round of applause. This is really, really well done. I love the argument as to whether this project is needed or not. The data is very compelling. The specificity of the geographical location where this program will be implemented, well-founded with data. I think I love the map, showing exactly the distance from the, from the healthcare provider to the women. This makes this really, really very compelling. And I know anybody who is from Zimbabwe will look forward to having this, and then you guys have become experts in Zimbabwe. I have a few things for you guys to take a look. The timeline, I thought the timeline was very good, but it's always very helpful to have a visual depiction of a timeline, right? And you have that timeline, but if you could add months and years so that we will know what is going to happen when. It's always very, very helpful. And again, your evaluation was very thorough. It was clear what you are going to measure, how you are going to measure them. The quantitative analysis was really well done. One thing I would like to see is to really be clear as to what are you going to achieve by what time. So it's always going to be, we are going to achieve X by Y. X being the anticipated, 85%, 80%, and it could be reduction for a bad thing or increase for a good thing. And so you can see we will do this by this time so that we know when are you evaluating yourselves. The Click Medic app is very enticing. The use of technology works very well, but I think it was a little bit, I needed to say a little bit more on what is this app? What is this app going to do? And how are they going to use the app? So these are just minor tweaks you can make to the proposal, both the documentation and the slides, and this project will be really, really ready to implement and look for funding. Yep. I see your hand up, Chivuka.
Okay, I just wanted to comment on the project. It was well structured, and maybe constructive criticism was maybe the transition of the slides. However, one thing I can also say is that I could imagine it back in Namibia, and where regions where we, even me, myself, in Namibia, where we can implement this project. We can look in the Kunene regions, we can look in the Karas regions here in Namibia, where I'm from. So it was part of, you are visualizing what the project is in Zimbabwe, but you're also looking it back to Namibia. Thank you.
Jivuka, I don't think I understood your question. What was the recommendation or remark? So the project was for Zimbabwe, but I heard you say a lot about Namibia.
I just said I liked their project. It was so visual that I was able to sort of see the image of it even being implemented in Namibia.
I see. Yes, that is really on point. It can be implemented anywhere. You can just take what has been done and replicate it in any part of the world, and that project will still work. Yep. Any other questions? Any other comments? From our guests, any feedback on the two projects? Don't be shy, our guests, don't be shy.
No, I was
yes.
Yeah, I was actually typing something in the in the chat, yes. And what the last person said, this project is something that you can really take it from the shelf and implement in all low and medium income countries. So one aspect I wanted to ask from you is that what next? We'll have a project, they have written something. What is the next step? Because you don't want the enthusiasm to go, even if it means whether you have someone who is in any institution. I see a lot of them that are very, very accomplished here who can be led into writing for soft grants. Let them try it first of all, because some of these multinationals will be very willing to stand it out. And like I said in my discussion to you guys, you have a cost now. You have something that is dear to you. You have friends that are part of the team. The world is such a global place that you can really implement. Most work these days are done by people living in different countries, but working in one particular area. So this is something that you guys should be, not just make it a paperwork, make it something that try. That's the whole concept I'm telling you. Try if it is even if it's reaching out to Eric for maternal and child health. You can take the group and reach Eric Nana to implement in Cameroon. He has a site already there, a site that is already there, and he'll be very happy to pick up this project to implement in his clinic, and it will be easier managed. And based on that, then you can take it and go from one country to other. He has a site in Ghana, he has a site in Cameroon, he has a site in Jamaica, where things to do with the infant mortality, and these are countries that have high burden of infant mortality. So it's something that I think you guys have a very good, robust training in it. And to my friends who are graduating, please keep this work that you've done, because you will need them. Don't throw away the slides. Keep them in your record book, because as you advance into the field of public health, times will come when you will refer to them to answer questions that come up in your career. That's all I want to say. And I want to say thank you, GHCP, for more is expected of you. That's not, I wouldn't say that you have done well. You have started, but more is expected of you. Make more soldiers, make more people on the forefront, and then push them. You see what you can do from the day starting to the end. You guys are doing a fantastic work. So thanks a lot for letting me share today with you guys, letting me share in the knowledge that you guys have created. Adele, bye everybody.
Thank you so much. The question about what happens next, Dr. Juan, I'm gonna give you the floor. Usually, like we said at the beginning of the course, once a PA 360 member, always a member. So the goal here is to finesse the program and then gauge interest among the research group and look for, low-hanging fruits, like prepare the grants and then begin to send them out. One interesting thing is that the world has become a global village. I see a lot of Americans who tell me they work in Africa. I see a lot of Africans who tell me they come to United States. So we are hoping that this will be the same for this project. So stand by, you're gonna hear from us. And this is really, really fantastic. Joanne, do you want to make final comments before we conclude?
Yes, thank you, Dr. Romy. First, I think the two groups teams, because they did a great job, they were more cooperative and coordinated with each other. First of all, I thank them for that and congratulate them for this work. I just want to make a modest comment that I think is my duty to put in this wonderful forum and on this great day on my behalf and on behalf of every college and follow in this program. I would like to extend all thanks and appreciation to those in charge of this program, especially the teaching staff represented by Dr. Magnus Azwini, Dr. Romy, Dr. Suzanne Maris Brown, and Dr. Nuziobi, and all the others. Thank you all for what you gave us updated and wonderful scientific explanation and extracted in the field of public health and on the board, the wonderful intensive program. In fact, you have enjoyed, this is the intensive practical program, and you have done everything in your power to make us benefit from it. And in light of it, we have become qualified soldiers. We are waging the battle to combat diseases and health problems all over the world, especially in COVID-19 pandemic, including areas most in need, achieving the goals of healthy, sustainable development. And for this, we could not thank you enough for us trained and this program. Please accept our shortcomings during this program. Thank you and all the guests who come with us on this wonderful day, and we wish everyone success. Thank you.
Thank you so much. Thank you so much, Dr. Juan. This is really, you are an example of resilience in public health, despite all odds.
Thank you.
You know, I could say something. I'm in Washington, D.C. I know where all the facilities are working. Mary and I are in D.C. Mary, Dr. Jones and I, we're in D.C. But the true soldiers are actually the soldiers that joined from areas that we know that the technology is so poor, but all of you continue to join, you know, continue to try your technology and to push. You could as well go to bed. You know, you could as well not join. You could as well say, you know what, the technology is really bad. I'm not going to enjoy today. But all of you for 3 solid months, you know, persevered and produced these programs, and look at what you have produced. The whole world is ready for these projects. So just a quick concluding remarks. The projects remain the property of GHEP, and we are going to work with each of the groups in order to see where to submit these projects. You know, if you have any questions, you know, you can add the project onto your resume. Brown is going to provide an example, you know, how you can do it. And we are working to get a 1-page summary of the project that you can really add on your LinkedIn profile. So please, we ask that you hold on the projects, you know, before you share them so that people don't pick them up. And before you know it, somebody is implementing Hello Mom and Baby somewhere. And you will be asking yourself, what is this? Is this not the project we produced? But congratulations again, all of you. On this note, I want to wish all of you very well. Please continue to check in. As you know, if you are applying for jobs, one of the things we do here is that we will continue to be your reference. We will talk to references. We will talk to job. Anywhere they are, feel free to give information that you were part of this program because you merited it. And that is our goal, to see all of you flourishing regardless of where you are. Don't be a stranger. Keep emailing us, and we will continue to email you, to reach out to you. You know, one of the students that joined us today, Emmanuel Boaki, joined us from Ghana. He was an alumnus. So we'll continue inviting you to review manuscripts for us. We invite you to be on the panel. Like you heard, the former group proposed that we should have every 2 years an international conference. So we are trying to get people to serve on that committee, you know, whether it's going to be in Washington, whether it's going to be somewhere else. But please stand by for opportunities. Follow us on social media, on LinkedIn, so that you will be apprised as to whenever we do events. So on that note, Brown has a concluding music, but everyone, I just want to invite you before we hear that music, Unmute your mics and let us give all of us virtual round of applause. I want to hear it where I am. This is really, really terrific. So we're gonna get departing outro music from Brown.